Hi everyone, and welcome to the final video for physical activity and mental health. So this video focuses on what the recommended guidelines are for treating depression and anxiety using physical activity. So this slide presents the National Institute of Health and Care Excellence guidelines, and this group basically produced evidence-based guidelines for treating different conditions. And these guidelines are then used by clinicians and practitioners in order to treat different conditions. So if we're thinking about depression, when it comes to the NICE guidelines, physical activity is recommended for people with mild to moderate depression. So it's one of a number of different recommendations. And the specific physical activity that is recommended is for people to be doing 3 times per week, 45 minutes up to an hour, over a period of 10 to 14 weeks. Now, importantly, this has to be delivered in groups by a competent practitioner. So it's a group-based physical activity programme. Now, some issues that we might have with this is that if somebody is depressed, then actually going to a group condition might be quite difficult. Finding someone to actually run that session or going to something that is run by a competent practitioner almost involves costs and the idea that they have to then go out and find this exercise class to take part in. Although we've seen from the evidence that 3 times per week and 45 minutes is really the optimum for reducing our mental health burden, for some people with depression, that actually might be quite a big undertaking. And importantly, the fact that it runs over 10 to 14 weeks indicates that there isn't any short-term benefit of physical activity. Now, we know that that might not be the case. So to try and change or try and reduce mental health burden in depression, it might be that we can do that in an acute setting, so using just 1 or 2 sessions of physical activity. But in order to deal with a chronic condition, we might need to undertake that longer, prolonged physical activity. So these are the guidelines. Please familiarise yourself with these guidelines as much as you can. So for anxiety, we actually don't have any physical activity guidelines. Anxiety is treated in different ways, and that's basically because the evidence isn't as strong as the depression evidence. So when that literature becomes stronger, we have more randomised control trials, that's when physical activity guidelines might be introduced. So importantly, if we're recommending that people do activity, we want to know that it's actually something that they want to do. So this survey basically looked at the acceptability of people willing to try various treatments. So they asked a number of different people what kind of treatments they would be prepared to undertake. And around half of them said that they'd be willing to undertake antidepressants, but around 3/4 actually said they'd be willing to try exercise as a treatment for depression. And of those patients who used exercise, around 80% of them found that it was an effective treatment. Now, importantly, how patients view physical activity as a treatment for depression may give us an indication about A, whether they're going to adhere to undertaking any physical activity, and B, whether it's actually going to be effective. So overall, people found that physical activity was an effective treatment and actually did enhance them. But it was really important in terms of their perception of what caused their depression as to whether physical activity was going to be beneficial or not. So in some instances, they thought that if depression was sort of a neurobiological factor, then physical activity might be useful. But actually, if it was caused by an environmental factor, then physical activity might be useful in terms of being a distraction, but actually they might need more counselling to try and deal with the root cause of that depression. So the cause of depression had a really big bearing on the extent that participants thought activity would be helpful. And a lot of the participants actually suggested that using medication was the first step that they wanted to do, and that actually then helped them to initiate physical activity and also adhere to that physical activity. So using the medication basically helped them overcome any barriers that they might face to physical activity. So it might be that we want to think about how we can use physical activity as an adjunct therapy alongside medication or counselling to try and help people improve their depression symptoms. But importantly, if we're recommending people to do physical activity, then we need to understand what specific barriers people may face when they have mental health conditions. So this study wanted to look at the barriers and motivators around physical activity for people with mental health disorders. And the main barrier that people faced, or that they reported, was their stress and depression. So their actual mental health issues were the main barrier. So the symptoms that go along with those conditions were the things that were stopping them doing physical activity. Now that might link back to the previous study that we've just looked at that said that medication actually then helped them initiate physical activity because it reduced the symptoms of depression. The other aspects that people thought were important and important reasons that stopped them doing physical activity was the lack of support. So they didn't have that social support around them to try and encourage them to do physical activity. They were tired or disinterested. And then down at the bottom, we have things that a healthy population would often report as barriers of things like lack of knowledge, fear of injury, and too little time. So we have the initial barriers that people would normally report in a healthy population, but then we also have the additional barriers of the actual mental health disorders themselves. But in terms of the motivating factors around physical activity, the main motivating factor that people reported was actually an improvement in their physical health. So although we're trying to encourage physical activity to reduce their mental health burden, the main motivator was a physical health benefit. And then other physical aspects such as reducing weight. We did have quite high agreement for those that agreed that physical activity would be useful for managing mood and managing their mental health. So there's quite a few motivators for people. And interestingly, the social aspects are quite low down on this motivator. So people weren't really interested in doing physical activity for the social aspects. It was more about the mental and the physical health. So when we're working with people that have mental health conditions, it's important that we understand the motivators for that, for undertaking activity and the barriers that people might face. So although we can recommend that people do 3 times a week in a group setting of 45 minutes for 10 to 14 weeks, there are additional barriers and motivators that we need to think about, try and encourage people to A, take up the activity, so follow up on any exercise referral that they have, and B, adhere to that physical activity programme. Okay, that's it for today and for physical activity and mental health. Hope you've enjoyed this session. If you have struggled with any of the topics, then please do get in touch for a tutorial. And as I said in the intro video, if you are struggling with mental health yourself, then please do follow some of the links that I've put on the website. Thank you very much.